SRNA versus nurse anesthesia resident versus resident nurse anesthetist. Let's talk title changes, let's talk about language, and let's talk about case law because there's a lot here. In the United States, the history of anesthesia is a little different than in other countries in that nurses started providing anesthesia back in the 1800s, and the fields of anesthesia evolved about simultaneously between the physician field and the nursing field. Let's talk about case law and what has established the precedents on language, titles, and the practice of nursing and the practice of medicine. We have many different lawsuits that have really put together a precedent for defining the different roles. Frank versus South is a particularly interesting lawsuit that we'll talk about. It was Frank versus South that was really one of the solidifying reasons that we established that anesthesia when practiced by a nurse is a practice of nursing, and anesthesia when practiced by a physician is a practice of medicine. Now, how does this tie into the student versus resident title? Because anesthesia is a practice of nursing when administered by a nurse, and it is our nursing license that enables us to practice anesthesia, the title student does not accurately represent who we are and what we do in the operating room. Therefore, nurses completing the residency portion of their anesthesia training are licensed medical professionals, just like physician anesthesiologists, and they're completing their postgraduate training in anesthesia in a residency setting inside of the OR. We are required to carry our nursing license with us into any OR that we step into. So any state that we rotate through for our rotations, we have to have an active nursing license in that state because we are completing postgraduate medical education. And we are required to carry malpractice insurance throughout the course of our anesthesia training in the operating room. Additionally, nurse anesthesia residents can be supervised at the same level that physician anesthesia residents are, which is 2 learners to 1 physician anesthesiologist or 2 learners to 1 CRNA. The title student is not confidence inspiring for patients, and when we are running the room and we are conducting the anesthetic, it's not an accurate representation of who we are and what we do to call that person a student. Nurse anesthesia residents also used to be paid for their training because we are providing labor to these hospitals. We are running ORs. We lost our funding about 20 years ago, and the reason that physician anesthesia learners are trained is because of federal grants from the federal government. I believe that those learners should keep their payment. I also believe that we should be paid for the work that we do.